with mild side effects.
Good afternoon and welcome to yet another exciting episode of a Mild Side Effects podcast. Hi Balazs.
Hi and welcome back to the most professional pharma podcast ever.
Balazs, I heard that today you wanted to start off with a quote.
Indeed, I do. So this will be a quote from my childhood, and a lot of you would recognize it and would get some chills, some else you won't. Let's see. So it sounds as the following. Woe to you, O earth and sea, for the devil sends the beast with wrath, because he knows the time is short. Let him who hath understanding reckon the number of the beast, for it is a human number. It is number 666.
I got chills.
Me too. And this is leading us to a topic which is not Iron Maiden, and God bless Bruce Dickinson and the whole Iron Maiden team. But we will talk about a regulation which has a number 2025/666.
And the question is, what the hell is regulation 2025/666? Welcome to the episode.
Yep, it's just shortly a cellulose-based additive review, what you will hear now.
Yeah, so we've heard the European Union trying to regulate everything, sometimes for good, sometimes for better, sometimes for worse. The number which you just heard from us is the Commission Regulation 2025/666. It's a review of two regulations. It's amending the food additives regulation, so that's the 1333/2008, and the regulation 231/2012, which specifies the food additives. So today we're doing a little bit of a sidetrack from the pharmaceutical industry to the what we would call the small and loud and noisy brother of pharma, which is the dietary supplements.
Or let's call it Nutra, but yeah.
Let's do it like that. So, Balazs, little side story. What is happening here, and what did EFSA do?
So EFSA is the European Food Safety Authorities, and as you know, it's a very important body, and it regulates and gives guidelines in matters of food and food supplements or nutraceutical products. And I wouldn't waste more time on that, but they are re-evaluating also materials time to time. And this is also what I would ask you, because you brought this whole topic to my attention, and thanks for that. It's a very important topic. Tell me how it started with EFSA.
So, well, as you said, that is correct. EFSA does re-evaluations of the data that they have on hand. This is like the titanium dioxide in the past, where EFSA did not have enough data and they started the re-evaluation, which led to the ban of titanium dioxide in food. And here we are encountering a little similar thing, and also some tightening of the screw, if I would say. So EFSA was reviewing one thing, reviewing the data on some cellulose additives that are used in some special applications like infant food and baby food. And they gather that they just don't have enough data on one of the additives, which is the E466, which is the sodium carboxymethyl cellulose. So as some would call it CMC. And so what EFSA did, EFSA decided that the CMC is no longer to be used in such applications. It's removing the use of CMC in infant and baby foods. And that's a valid point. EFSA decided that they're doing it like that. They are giving a specific timeline, and then there will be products that will be allowed to be put on the market, and at some point they will give a sunset to the application of E466. And in this time, the owners of the brands that are working in this segment will have to reformulate. That's a fair thing. It's of course going to be costing these companies, a lot of work, a lot of efforts to reformulate those products because, personally, myself, I've been working with carboxymethyl cellulose in the past, and it's a good thickener for lots of syrups, suspensions. We use it in pharma a lot for such applications where you would need your syrup to be thickened or suspended. But here in the dietary supplement, this is not actually dietary supplement. This is the infant and baby formula. It's going to be moving away now.
Tell me, because in food supplement usually the reformulations go relatively fast compared to pharma, but give us a little hint. How easy is it in early life nutrition or in infant formulas?
I'm personally not an expert on that as well, but you'd imagine that there is a certain level of scrutiny on such delicate applications, right? Because we're talking here about very small children, so the scrutiny is definitely there. I would say probably to a certain extent like a pharma level of scrutiny, of course, in the food industry, right?
Right.
But again, we're touching on this because there is a change here ongoing, but there is a small but. The regulation has also done some other things, and you would ask me, Balazs, hey Michał, what are the other changes?
Indeed.
And that's in personally, when we spoke about it before the episode, when we were gathering our data and analyzing this topic, we decided that this is something that is more interesting for us, at least. And here is the why we think it's a big deal for the small loud brother of pharma, the dietary supplements. So with this regulation 666, what EFSA has also done is also change some specification on cellulosics. And these cellulosics are not only carboxymethyl cellulose. It's impacting such things as microcrystalline cellulose or powdered cellulose, methyl cellulose, ethyl cellulose, hydroxypropyl methyl cellulose, hydroxypropyl cellulose. So, all those cellulose derivatives that are important technologically for the dietary supplement market. You would imagine, that for the dietary supplements, the backbone of the formulation is MCC, right?
It's not lactose typically.
No. It's because typically MCC is chosen because it is a cellulose. It's plant-based. It can meet vegan requirements, and it's relatively cheap. It works well to tablet. And then some other things like HPMC, for example, where you would use these for film coatings, in some special cases in the nutraceutical space where somebody would actually think of that for some sustained release, where you would use HPMC in the tablet matrix.
All right.
And then and then one other very, very important, HPMC is used in vegan capsules, as you are aware of that, Balazs.
Indeed, capsules, very important.
Exactly. So what is the change here? The change, my dear friend, is the tightening of the specifications in the regulation 231/2012, where it tightens on the heavy metal specs. We know that there's these 4 riders of apocalypse in terms of heavy metals. If we are talking now in heavy metal terms.
Very well done.
Thank you very much. I'm very proud of myself. So it's lead, arsenic, cadmium, and mercury.
Yeah.
And the levels here were in the areas of milligrams per kilogram, right? So ppm.
1, 2, 3 ppm.
Yeah, exactly. It's depending
levels.
on the heavy metal.
Yeah.
Right now, the regulation 666, the number of the beast, is tightening for almost all of these cellulosics, and for the MCC, HPMC specifically, to the level of 0.1 milligram per kilogram, so 0.1 ppm. So it's tightening, at least like by 1-fold, right? And then it depends on the number here. So we think that it is an important matter.
Yeah, and it comes to question, because I've seen the data, and it's one of the strange cases where if I look at the pharma regulations and requirements, ICH seems to be way less strict with those numbers, and we understand that it's different because pharma is taking their own rules and taking into consideration that this is a drug and it's healing or treating an illness, a disease, and therefore we take certain calculated amount of risk, and this is rightly so. But again, it seems that food, or because this is a food regulation, at the end seems to be like 20 or 50 times stricter than the pharmaceutical one.
Welcome to the funny segment of the Mild Side Effects podcast. Previously, we did a small quiz with Balazs, and we decided that it's an interesting segment.
And this is the most beloved one, to be honest.
Yes, and I would say that I royally messed up last time, which I'm going to try and not do again. But let's see. So last time we were doing a segment called Lord of the Rings or Drug Name.
Classic.
This time we're going to do it a little bit more difficult for Balazs, because as we discussed before recording this episode, Balazs has absolutely no idea about the genre or the universe of the new quiz.
Yeah.
So the quiz is going to be Pokemon versus drug name.
Yeah, and so we will lose also a little bit of audience with that because people will hate me for that. Sorry. Yeah.
I mean, I'm sorry, I remember as a teenager I used to watch Pokemon on TV. So, I mean, at least there's a couple of people around my age here following us, so I'm betting a little bit that they would like it as well. Of course, like in the case of the Lord of the Rings and the drug names, we're not going to be calling out the Aragorns and the Legolasses and the Frodo and Bilbos. So in translating to Pokemon, there's not going to be a Pikachu or a Charmander.
That was the only one. I don't even know the second one. So yeah, I'm entirely based on my pharma knowledge. So yeah.
Okay.
Let's see.
So Balazs, in this case, just roll the dice and see what comes out of it. And I have let's agree that we make 4 rounds, so
Okay.
I don't mess up with the score like last time. It's going to be
Please.
4, and I have to calculate from that.
Yeah.
Okay, so the first two names, first pair, Zorvolex or Xatu.
Zorvolex is a drug.
Zorvolex is the drug, Balazs. Xatu is a Pokemon.
I had no idea.
Okay.
Jesus.
So the second pair is Timsia and Bruxish.
I have no idea. Timsia is a drug.
Yes, Balazs. Timsia is a drug.
Very lucky, to be honest. I have no idea what Timsia is. I have to look it up.
Okay. Then the third pair is going to be Gennark or Tornadoes.
Tornadoes, I can only think about Beefsteak and Tornadoes, the Rossini, but Tornadoes should be the drug. No idea. It's just guessing.
Tornadoes is the Pokemon.
And what was the other
Gennark
one?
is the drug.
Okay.
Gennark.
Are there any Y's?
I'm sorry.
in it?
Yeah, let's. Gennark, yes. Jyn.
Okay. I will Google them later.
2-1. Let's last one.
Please.
Okay. Okay. Golisopod or Vrailar?
Vrailar is a drug.
Indeed, Vrailar is a drug.
I heard about that at
Balazs.
least.
So, Balazs, I asked you 4 questions. You
No,
got 3 of them right. It's
I
3
got
to 1.
I got lucky with Vrailar because I'm so much interested in antidepressant and bipolar depression. That's why that helped me out. We will have a session about that later, not today. But I was lucky again.
Yes, Balazs has some ideas for future episodes. We have ideas for future episodes. Definitely will not leave you hanging with uninteresting topics. So this was the fun segment of Pokemon versus drug names, and now back to regular programming. So we hope you enjoyed our short quiz, and now let's get back to the serious topic. So, I mean, we agreed that this tightening of the heavy metal impure. I mean, in this case, it's not the heavy metal impurities; it's the content of heavy metals in the food regulations is getting much stricter than the actual ICH guidelines from the pharmaceutical industry, which is not something that you see on a regular basis, right, Balazs?
That's clear. And what is clear that it has impact, and let's discuss a little bit that what it will cause.
Well, I mean, the timelines on this have already been running, and things are set in place. So, I mean, we would expect that companies operating, in the Western markets, the typical excipient manufacturers which we come to trust, they've already done this, right? And we've been looking at some specifications of known manufacturers which already state this, right?
And they seem to be quite well prepared. They are offering, at least in their portfolio, these cleaner or low impurity products.
Exactly. But on the other hand, then if we, let's say, go into manufacturers from other territories, or maybe some more obscure manufacturers, because we can imagine that MCC is a commodity that is manufactured by dozens of manufacturers, and HPMC maybe by a little less than that. When we would go to the websites of these manufacturers, we probably wouldn't find much information on it, much data. I mean, we did click through a couple of them, and
some of them were already offering, but yeah. It's definitely no big campaign and no big news. Yeah. And
the reason why, I mean, we are making a fuss out of it is the actual analytics. So I can safely say finally my degree in analytical chemistry is paying off. Haven't been using that for 19 years since graduation.
That's not true. You use it daily.
but then we were talking about these specific changes. So you were going from single-digit ppm to 0 point something ppm, 0.1 in this case, right?
0.1.
So it's again a one-fold change, and the thing that you would be starting to think in this case is, are the methods that are used typically for this analysis valid to make sure that the results are being done correctly? Because some methods have what we know a limit of quantification and a limit of detection. So typically when you would be using it for these ranges that were in the past for the heavy metals in food, you would employ maybe some let's say a little bit cheaper methods like ICP-AS, so atomic absorption spectrometry, or OES, optical emission spectrometry, which would have, I would say, a much higher threshold than the new proposed limits to allow us to quantify this. So basically, it's a case where the manufacturers would be having to opt to switch to, for example, ICP-MS, mass spectrometry, which is a much more costly method. I'm just thinking here, of the potential impact, because I'm not sure if these companies would always try to employ methods like that from the start.
And this is also a validated pharma method typically, so and more expensive one for sure.
And then what we would also, Balazs, we might could see is that in some cases, these companies that would be employing ICP-MS would be doing like not batch to batch checking, but like a skip lot, right?
So
They could do like
quite
a couple of
frequent one.
batches per year, and that's it.
We need to invite and do an infant formula special day as well. And we already have a person for that who is very nice and kind and expert in that matter. But my guess is even if for infant formulas, they might require a real batch to batch check.
I mean,
Can
I
be.
would say so because I mean, unless there is really, but well, we do skip lots, right? The manufacturers of excipients do skip lots because
Yeah,
typically
based on
the
risk assessments. Yeah.
yes, risk assessments, and that the material is very well characterized, and that's fine. But that's for like typical analyzed parameters where it's more relating to the fact that is this the material that we are actually testing. So like identification tests are very often skip lot because it is the excipient that we are testing and we are sure of it because we've been doing it for 40 or 50 years. But
we really
heavy
quantify
metals heavy metals is something that that it can come at some point and there's something happening in the production site, the water quality,
Whatever source. Yeah.
whatever thing. So this is not something that I think can be skip lotted.
And it's also usually what my previous experience with quality directors from pharma was that they allow, based on a good stable risk assessment, skipping certain lots or doing fewer or less frequent testing. But that's typically when the process is well established and all the suppliers and the materials are qualified and validated and the whole process is running well. And typically for many, maybe even for after 100 batch, then they tend to say, okay, this is a very safe process and the risk is low. Then they say that less frequent testing is they are fine with that. We are not there.
Yeah, I'm going out on a limb here. I mean, my position is that I don't know what these companies would technically say, right? If they are prepared on it, yeah, of course. But what our intention today is to bring the actual noise around this, because quite frankly, and here's another satanic reference for a regulation that is called 666. There is not much screaming and flames appearing. The silence is as
deafening.
Quite deafening. You can hear pin drops in this case. And I was doing some exploration on the regulation, and in case of, for example, the Polish part of the internet, the information, what the information was on the regulation 666 is that the GIS, the authority for food in Poland, has made a spelling error in the publication. So it's that's what you find when you search for info on this regulation. There is not much talk about it, and that's one of the reasons why we decided to do that talk, because our feeling is the industry aware of yes, of course. I mean, the people have to have regulators who are people in regulatory who are following the regulations that are coming out, make sure that the material is compliant to those regulations, because in side of the food industry, we are talking here a little bit more about NutraSpace. We have a lot of materials that are used in the dietary supplements. MCC is, I would say, one of the mostly used excipients in the nutraceutical space when you're making tablets. It's the cheap, reliable filler for those tablets. And on the other hand, we have HPMC, which is the go-to solution in terms of capsules. And it is the go-to solution when we are talking about film coatings for the tablets. So PVA, of course, can be used, but from a perspective of clean label in the nutraceutical space, HPMC is regarded as the friendly cellulose, right? It's as we all know, it's the capsules are being referred to as cellulose capsules and not HPMC to make it this chemical name.
Sounds better, and and that matters for nutra marketing. Yeah, it does.
So just to summarize this, like, Balazs, what would be the actual impact here? Like, of course, we understand the baby and infant food, they have to reformulate because they are basically not going to have one of the raw materials there, and of course they could look at other thickeners, stabilizers into that area, and they probably are looking at it. But here the impact for the nutraspace is more scrutiny. And how would you assess it?
Yeah, I would say that I would expect a lot of qualification and testing. Also in the labs. Labs should be full. Of course, also on the supply side, that the suppliers would provide these low impurity grades, which they mostly have, but that I would expect that they are not endlessly available and might be short, maybe not. Coating systems would be reviewed and also re-evaluated. Same goes for the whole nutra industry and tablets, because still tablets are there. I know a lot of other forms are coming, including my favorite forms, but tablets still there. And if it's MCC based, can you do, because I'm still not 100% sure, MCC needs to be out from food supplement as well. Is this correct? Or I was misreading?
No, you were misreading. It's the CMC, carboxymetyl cellulose.
Sorry, CMC. Yeah, the CMC is out. Yeah.
No, CMC is out from the baby and infant formula. This is a specific, in the in the food applications you have I think 17 categories. I'm also not an expert. The category 17 is dietary supplements. I think that is there. The regulation removes, and let me quickly scroll. Yes, the regulation, due to persisting lack of data, the authority did not perform an assessment of safety of use of sodium carboxymetyl cellulose gum in food categories 13151 and 13152. So that's a decision tree that is there, and that does not mean that you are now not having carboxymetyl cellulose in the supplements. That's the category 17. So so that's fine. But
definitely, I would expect that. I don't know if pharma wholesalers who are bringing also nutraceuticals, food supplements to pharmacy chains, because this is the route, will they demand ICP-MS data on the new impurities, or it's already done? Maybe.
The thing is I think the scrutiny should be on the side of the dietary supplement manufacturers to do this, because overall the supplements have to meet, like the final product has to meet some requirements, right? But the incomings are having a much stricter impact here, and I believe that's where the responsibility lies. That
that's clear.
Dietary supplement manufacturers have to really look at the C of A's that we're receiving right now and see if the manufacturer is declaring that the specification is in line with 2025-666, or are the heavy metals listed there to the level that the new specification now has. So I think that's where it lies, because quite frankly, if I'm thinking about the food authorities checking these products, then we have to pray to the deities up there to make that happen, because they won't surely do that. Yeah, so it's a fun topic for everyone, I would say, right now.
And I'm sure that we will hear more about that.
Well, at least we are making some buzz about it, and with us, you won't hear any more pins dropping.
And it might be that it's really well controlled, and we just we were not hearing enough about that, and that might be the story.
Indeed, and that's a fair point. It's a case where we've seen some manufacturers already showing those levels, right?
Yeah.
So that's the serious tier 1 manufacturers of cellulosics. Yeah. Whether it's Japanese, American, right? Let's see how the others react.
I definitely checked some of the brochures from CPHI, and I checked a couple of HPMC one, and some of them were already making flyers on that one. I wasn't paying too much attention at that time there. A long time ago, 5 weeks ago. So,
yeah. In the end, I mean, if I were to summarize the takeaway from this regulation, is that regulation 2025-666 is not the end of the world.
No, but it's also an easy one to remember.
Exactly, and it's I would say more of like creating a new chapter in putting more and more the bar higher up, right? And that's how I would summarize it.
And European food supplements will be even cleaner and higher quality than probably. Yeah, they will be the best in the world in that matter.
Let's keep fingers crossed. We're like our friends from the dietary supplement industry. And let's use this opportunity to say hi to everyone. Hope you're listening to us, and we hope that your MCCs and HPMCs and other cellulosics are at the quality that are required by the new regulations, and we're happy to use your high quality supplements.
Keep them dry and safe.
Good. So this was another fun, action-packed episode of the Mild Side Effects podcast. My name is Michał.
And this is Balazs.
Thank you very much. See you next time.
See you. Bye.
Mild Side Effects.